I'm absolutely delighted now to be joined by Dr. Chang. Dr. Chang, welcome.
Good morning.
Thank you very much for joining us today.
Glad to be here.
Now, we've got you here today to talk about your role specifically as Vice Chair for the follow-up of clinically localized renal neoplasms. So tell us a little bit about that.
Well, this is, as you know, the AUA has done for many years guidelines for different types of treatment options for different maladies, be it renal stones, be it different types of cancer. This is the first one that actually was focused on a cancer follow-up to try to give clinicians guidance on how they should do imaging, when they should do imaging, what should be done, that type of thing. And so it was led by Michelle Donat from Memorial Sloan Kettering, and I was fortunate enough to be part of that panel. It was a panel that brought a lot of different urologists from different areas of the country to decide what's the best way to follow up patients with clinically localized renal neoplasms.
So Dr. Chang, what are some of the guidelines?
Well, one of the important things that we have with the guidelines is an attempt to stratify these patients into lower risk or higher risk. And trying to come up with a plan that not only follows these patients carefully, but then doesn't follow them too closely. It's dependent upon really what the pathology is, how aggressive the tumors appear to be, and that gives us an idea of what should or shouldn't be done. It also takes into account those patients that don't have therapies and are actually undergo active surveillance. And it also looks at some of the more recently, I guess, started treatments like radiofrequency ablation, cryotherapy of these small renal masses, and gives us an idea of how we should follow those lesions as well. So it's a combination of therapy as well as active surveillance for these patients.
A lot of work went into this, didn't it?
Well, I think Dr. Donat did a wonderful job of really bringing a diverse group together. Everybody has their opinions, and it was really, I think, under her leadership that really brought a consensus together.
You're a busy fellow this week at the...
I think everybody's busy at the AUA.
Yeah. I know you're also at the FDA AUA panel. Tell us a little bit about that.
So the FDA and the AUA have come together to actually have two different panels. One is on prostate cancer and one is on bladder cancer. And the one on the bladder cancer really is an attempt to give the FDA some guidance regarding what are new pathways that we can actually develop to help bring new medicines and treatments for non-invasive bladder cancer. This is one of the most common cancers that urologists treat. Lots of different treatments are out there, and this is an attempt to give the FDA, hey, what can we do with these new medications? How can we evaluate them, and how can we more quickly get them from the lab to trials, and then fortunately or hopefully to our patients? And so that brings, again, a diverse group together.
Well, thank you ever so much indeed for joining us today. It's been fascinating to chat to you, so thank you very much.
Thank you very much.